Hello everybody, I'm just going to tell about a little talk about anxiety disorder of children. We are talking a little by little different aspect of it. So basically this is the almost last session where we just going to tell you something about, a bit summarization. So anxiety disorders are common treatable medical conditions and affects 1 in 8 children, and it is characterized by persistent, irrational, overwhelming worry, fear, anxiety interferes their daily activity, and the real disorder that affects how the brain functions. Symptoms vary. It can include irritability, sleeplessness, jitteriness, and physical symptoms like headache, stomachache. And this disorder can prevent your child from making friends, raising hand in the class, or participating in the school or social activities. Feeling of being ashamed, afraid, alone are not uncommon thing. So research has shown that if it is left untreated, with anxiety disorder are higher risk to perform poorly in school, miss out an important social experience, and may engage in substance abuse. So anxiety disorders often co-occur with other disorder like depression, eating disorder, hyperactivity disorder. So whether your child has been diagnosed with anxiety disorder or you are concerned about this behavior, it is important to talk about it, isn't it? With treatment and support, child can learn how to successfully manage the symptoms and live a normal childhood. So is it just a phase like anxiety versus anxiety disorder? We have to think about it also. So anxiety is normal. This is a part of childhood. Every child goes through the phase. Some may eat only orange food or count in twos. Others may have an imaginary friend or recurring nightmares about monster under bed, like these things. So the difference between a phase and anxiety disorder is that phase is temporary and usually harmless. And children who suffer from anxiety disorder experience fears, nervousness, shyness, and avoidance of places and activities that persist despite the helpful effort of parents, their caretakers, or teachers. And anxiety disorder tends to become chronic and interfere how your child's function at home and school. To that point, your child becomes distressed, uncomfortable, and starts avoiding activities or peoples. So this is the way you can understand. So unlike the temporary phase or fears, such seeing scary movies or having trouble falling asleep, reassurance and comfort is not enough to help the child with anxiety disorder. So in that way, you have to talk to your doctor and you have to figure out that what normal behavior for the child's age and developmental level. So in that case, Now how it happens, this is another thing. Sometimes it may things. It is combination of biological and environmental factor, similar to allergy and diabetics. Stressful events such as starting new school, moving, loss of parents, or near family member can trigger onset of anxiety disorder. But stress itself does not cause an anxiety disorder. Anxiety disorder tends to run in family, but everyone who has this has one passes, but not that everyone that passes this to your children. Neither it is you nor your child is in fault. And an anxiety disorder diagnosis is not a sign of weakness or poor parenting. And this is always I have discussed about different type of type already about this anxiety disorder. So basically we need to think about when that talking with these professionals. Basically effective treatment options are there. True treatment most help the children to overcome anxiety disorder is cognitive behavioral therapy and medication. So maybe that one that can effective, or maybe combination. No one treatment works best for the child. One child may respond to one with a better, sooner and particular method, other one and different way with the same diagnosis. Important is discuss with the therapist or doctor and they decide what can be the best treatment. Cognitive behavioral therapy, that is talking therapy, shown to be very effective in the anxiety related disorders. So basically that cognitive behavioral therapy teaches the skill and technique to your child, so they can use that to reduce their anxiety. So basically that child then learn how identify and depress their negative thinking pattern and behavior to positive thinking pattern. So basically this is the way support is very important, that your carer support is very important to success in this therapy, that different short-term therapy and long-term therapy. So depending on different way it can be, and prescribing medicine can be another effective things. It is cognitive behavioral therapy and medication usually together can be useful for that. So anyway, this type of, you have to talk with your doctors, and also doctor will refer to the therapist to be successful. So basically if you see any of this sign of this anxiety disorder, talk to your doctor, and it will be helpful for you to get the direct exact direction for proper treatment. So hope that helps, and stay healthy, keep yourself healthy and safe.